Behavioral disorders in children. Sometimes abnormal behavior could be a symptom of a behavior disorder that needs the attention of a medical practitioner. We have listed out some of the common behavioral disorders in children. Number 1. Oppositional defiant disorder, ODD. Oppositional defiant disorder is a disruptive behavior that commonly affects children. Symptoms of this disorder include gets angry, throws tantrums, outbursts frequently, and has low or no self-esteem, is hostile to rules, annoys others deliberately, blames others for all misdeeds. Number 2. Conduct disorder, CD. Children who have CD, conduct disorder, are known for their delinquent behavior and not obeying rules. About 5% American children who are below 10 years of age have CD, conduct disorder. The typical behaviors are refusing to follow the rules led by parents or school authorities, repetitive truancy, trying abusive substances like alcohol, cigarettes, and drugs at a very early age, always ready to fight, aggressive towards animals and pets, use of weapons, lying frequently, indulging in criminal acts like committing burglary, lighting up property, and breaking into houses, running away from home. Societal tendencies, although rare. Number 3. Attention deficit hyperactivity disorder, ADHD. This is related to conduct disorder. Common characteristics of the disorder are hyperactivity problems related to attention, impulsive behavior in children, etc. Symptoms include trouble focusing on one thing, disoriented when you speak to them, difficulty remembering things, instructions, directions, etc. Inattention to detail. Number 4. Learning disability. There are different kinds of learning disabilities with varying symptoms. These disorders affect the child's academic performance and need the expertise of special educators to stay on track. Unable to comprehend instructions, short-term memory, poor communication abilities, antisocial personality disorder. A child suffering from this disorder may become indifferent to others' problems. This disorder may aggravate in later age stages of life and result in illegal and non-ethical activities of the individuals. Number 5. Underdeveloped social skills. This may sometimes be referred to as Asperger's syndromes. इसको Asperger's syndrome, which is a neurodevelopmental disorder named after an Austrian pediatrician, 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 hence Asperger. This syndrome is usually a result of social interaction impairment. The exact cause of this syndrome is unknown. However, psychiatrists consider it as a consequence of a series of symptoms. The common symptom of this disorder is difficulty in starting a conversation in public and casual interactions. Child behavior disorders become more visible as he grows up. However, you can identify abnormal behaviors when your child is still a toddler. It helps you to nip them in the bud. Behavior issues and toddlers. Misbehaving toddlers can be a handful. Reasoning won't work with them, and punishment will only make their behavior worse. So, what do you do? Keep reading to know about common behavior issues at preschool age and how you can help them. Number 1. Interrupting. Little children tend to get excited quickly and cannot control their urge to say what they want to say. They keep interrupting you all the time. Number 2. Screaming. Toddlers, especially those younger than 3 years, cannot express themselves verbally. They tend to show their anger or frustration in different ways, including screaming. Number 3. Running away. Does your child run away and hide when he gets angry? Running is dangerous, especially if she does it on roads, supermarket, or other public places. But you can keep her safe by. Number 4. Pulling hair. Toddlers may tend to scream, kick, and pull hair to fix bad things. The only way to make them stop such behavior is to make them understand that it does not work. Number 5. Throwing things. Children between the age of 18 months and 3 years are the ones who usually throw things to show their frustration. They tend to throw food, toys, or anything that they can get their hands on, just out of curiosity or frustration. Some of the characteristics of the students who bear good behaviors are as follows. They listening attentively when the teacher or others are speaking, raising hands in order to speak, staying on task and not distracting others from their work, sitting in assigned seats unless otherwise specified, using appropriate language, coming to class on time and prepared, treating others as you wish to be treated, being respectful to staff and students, keeping area desk clean,